Somebody asked me at the weekend, will we cure cancer? This is a big word. It's a big ambition because there's so many different types of cancer that, that's a big word that covers a lot of different disease types. But I think we'll be able to cure a lot of them.
Are you going to be a part of that?
I hope so. Well, hopefully you can tell by my smile that's the sort of thing that motivates us, is to really drive towards those kind of inventions. And who'd have thought where we were now if we'd looked 20 years ago, right?
How are you? I missed you. So good to see you.
Hey, Aaron.
Hey, Aaron.
How's it going?
Good. Good to see you.
Welcome. Come on in.
Thank you.
Thanks for bringing those peppers.
Of course.
We've now been doing this for 10 to 15 years. And
Don't make us old.
I won't put specific numbers in there, but it's been that long where we're working with our teams to innovate. We're being the voice of customer.
Just hearing all the great things that were happening at the organization at the time, and now Cytiva, of course, and getting in on something that big, was exciting. I'm not gonna lie to you, it was sort of like I need to be a part of this. So
it was fantastic timing too. Before I get too far, you said how's that for sizing?
That's good. We could go even a little tinier if you.
All right. Yeah. No, I can manage that. I can manage that.
So 10, 15 years ago, I was a commercial guy. My role was to support people in cord blood banking and in academic research mainly. Meanwhile, actually, there was sort of this research happening, particularly in the US, places like MSK and UPenn, into how we could transform T cells and use those for fighting cancer. But that was a little bit quieter in terms of under the radar from where I was sitting, particularly until after 2010.
The leading pioneers in cell therapy at the time, as the field kind of slowed down in the MSC space and started to look towards T cells and immune therapy, was predominantly academic in nature.
If you look at it just at the atomic level, something like aspirin is composed of 21 atoms. A biologic, drug, about 1,500 atoms. Then you get to a viral vector, which is 10 to the 5 or 10 to the 6 total atoms. Then you get to gene-modified cell, like a CAR T therapy. It's just, orders of magnitude of complexity.
Yeah, one lesson has been, these complex cell and gene therapies, like we've been saying from the beginning, they're multidisciplinary. There's virology, immunology, cell biology. So we had that embedded in this environment here, and that really promoted the research. The CAR T cell stands for chimeric antigen receptor. And chimeric comes from the Greek word of a chimera, which was a mythical creature that was 3 animals. It was a goat, a serpent, and a lion's head. And what we did was put an antibody from a B cell into a T cell, and that's why we call it their chimeric. And so that's how we treated Doug Olson first. And we treated about 3 patients then, adult patients with chronic leukemia. And so we treated Emily Whitehead in April of 2012. And as a first pediatric patient. She was 6 years old at the time and had multiply relapsed leukemia. And we infused her here at Children's Hospital in Philadelphia on a Tuesday, but on Friday she had very high fever. She was so sick at that time that I had written a letter to go to the president of the university saying that a child was likely going to die from the toxicity.
Yeah, so certainly there were, real leaders in the industry and key opinion leaders and people within the businesses that were, would say, forget about the sort of the risky stuff and the future stuff. There's, let's focus on, cord blood and more traditional types of medicine, and how can we support that in the short term. But I think we have to take some risks in this industry to move things forward. So.
And she had a very strong response. She got very sick, which we now know meant the cells were working.
Right.
And over the course of just a few days, her cancer really disappeared.
Wow.
And now we're 10 plus years out, led to the Novartis licensing and ultimately the 2017 approval of CAR T as a therapy.
The result with Emily Whitehead was beyond our wildest dreams. It turned out 90% of patients treated on our trial here at Children's Hospital, in the first 60 patients we had, 90% had a complete remission. That's unheard of.
Yeah.
So that allowed us in 2012 then to begin this journey of asking, could you commercialize that?
So really, that one patient almost opened the path for the entire field and for other patients. So just a remarkable time, exhilarating time at, when those initial responses were happening. And I think it goes back to that initial need that Cytiva was able to fill and really enable the industrialization and globalization of these therapies beyond these limited academic centers.
That was definitely, it was basically the time where we all looked at each other and said, hey, our customers are scaling up. They need something bigger. They need something that can do more. It's really, we're going into that GMP environment.
Yeah, I think, the leaders at the time took a risk, but it was a pretty calculated risk. I mean, the results of what was happening within that CAR T space at that time, the phenomenal sort of results that they'd achieved, which were beyond expectation, I believe. Yes, there was some vision, and it took vision from those guys to see beyond the short term and see long-term play. But that's really what the leaders of the company at the time did, and it was pretty. Well, I'm certainly very grateful for that vision. But it's something that I think those guys can be proud of taking that risk.
There was a handful, less than 5 people, labs in the world working on this back in 2010, when our first patients were treated. And now there's more than 1,000 trials underway and thousands of laboratories working on this. So there's no way I could have thought that when this, the first approval happened, that we would have this kind of progress in such a short period of time.
If I go back to sort of industry 10 years ago, they were in rooms smaller than this room, with a couple of incubators and a hood, and I walked into one of these sort of commercial manufacturing centers, and it was like a warehouse. And it's full of equipment that's digitally connected, and it's a world apart from where we were. And for me, what hit me was that change, that growth from 10 years back of what a manufacturing facility looked like back then to there, and to then put that forward and think how many patients, how many families' lives will be impacted by the activities in that room. Yeah, that was pretty impressive. I was proud of what the team has done, what the industry has done, and just to be a small cog in the wheel of it has been, that was pretty fantastic. It was a good moment. What can I say?